Hi, my name is Andrea Roger, and I'm doing a disease on hyperthyroidism. Okay, we're going to use the overview of the thyroid gland, the target tissues of the organs, Graves' disease, the signs and symptoms of Graves' disease, treatment of Graves' disease, and the progression of Graves' disease. The thyroid gland is mainly responsible for the body's metabolic rate. It basically is a chain of events. The hypothalamus stimulates thyroid-releasing hormone, which stimulates the pituitary gland to release thyroid-stimulating hormone, which causes the thyroid gland itself to release T3 and T4 into the blood. The thyroid hormone is basically, they help in oxygen consumption, generate body heat, increase protein catabolism, promote gluconeogenesis, increase the utilization of glucose, and promote lipid metabolism. Alright, the thyroid hormone targets many tissues and organs, such as the cardiac system. Increases heart rate, myocardial contraction, and blood volume. On the other hand, it stimulates the production of cytokines and the factors that promote bone growth and development. They also heighten the adrenergic activity in nervous system and help with the fetal development and growth. Graves' disease is the main cause of hyperthyroidism. It is the over-functioning of the thyroid gland. It is mainly an autoimmune disorder which causes antibodies against a target TSH receptors called TSI. And it's overproduction of the T3 and T4 levels in the blood and a low production of the thyroid stimulating hormone from the pituitary gland. And normally how the thyroid gland works is that if the T3 and T4 levels were abnormal, it responds by negative feedback where it tells the TSH to release more hormones and the T3 and T4 will go back to normal. However, Graves' disease does not allow the negative feedback to work, so it does not respond to negative feedback, which is why the T3 and T4 cannot go back to normal. The signs and symptoms of Graves' disease, in some cases there are goiter that is present, but not always. And the signs and symptoms can be categorized into two categories. One category is the adrenergic nervous system, which you can see signs and symptoms of tachycardia, increased systolic pressure, palpitations, depression, anxiety, and nervousness. On the other side, the hormone levels in the body, they can cause signs and symptoms of increased oxygen consumption, hyperphagia, weight loss, physiological disturbances, and tachycardia. Alright, there's treatment for hyperthyroidism. There's two different kinds of treatment. One treatment is definitive therapy. Definitive therapy involves the normalization of serum levels of T3 and T4 concentrations. There are three different kinds of therapy used. One is surgery. It is for patients who have enlarged goiter and when anti-thyroid drugs and radioiodine is not optimal. Another one is anti-thyroid drugs, and it is used to alter the thyroid function from abnormal back to normal. Radioiodine is another, and it is not preferred because of the side effects it causes on the patients. The other therapy is palliative therapy. Palliative therapy interrupts the adrenergic signs and symptoms without having to correct the thyroid gland function or cellular hormone. Three kinds of therapy used. The beta-adrenergic blockage reduces or normalizes resting heart rate, decreases tremors, and increases muscle strength. Anticoagulation are used for patients who have atrial fibrillation to prevent systemic embolism. And the other is iodine, and it helps to reduce T3 and T4 levels in the blood. Progression of hyperthyroidism without it being treated can cause an increased left ventricle mass, changes in systolic and diastolic function, atrial fibrillation, cardiovascular disease, osteoporosis, and eventually mortality if not treated. Alright, and these are all the references that I've used. So thank you very much.